Hi, this is Dr. Rafullah speaking. In today's video, we are going to discuss medication option, management, and things to avoid in case of diabetic emergency. Medication option for diabetic emergency. Number first is glucose gel or tablets. For cases of hypoglycemia, low blood sugar, glucose gel or tablets can be administered orally to rapidly rise blood sugar level. Second is insulin. In case of diabetic ketoacidosis DKA or hypoglycemic hypersmolar rate HHS, insulin is used to lower high blood pressure level. Third is epinephrine. If any individual with diabetes experiences a severe allergic reaction if anaphylaxis along with hypoglycemia, epinephrine may be necessary to treat the allergic reaction and raise blood sugar. Fourth is glucagon. This hormone can be injected in emergency situation to raise blood sugar level when a person with diabetes is unconscious or unable to swallow glucose. Fifth one is oral anti-diabetic medication. Depending on the type of diabetes, oral medication like metformin, sulfonylureas, or dipeptidyl peptidase 4 DPP4 inhibitors may be used to manage blood sugar level. So these are the fifth medication for diabetic emergency. Now let's go toward management of diabetic emergency. Number first is hypoglycemia, low blood sugar. Administer glucose gel or tablet. If diabetic emergency is due to hypoglycemia, so your strategy will be administration of glucose gel or tablet. Offer fast-acting carbohydrate like fruit juice or candy if a person can swallow and is conscious. If a person is unconscious, seek immediate medical attention. If your diabetic emergency is about diabetic ketoacidosis DKA, hospitalization is typically required. Intravenous fluid and insulin therapy to lower blood sugar level. Frequent monitoring of blood glucose and electrolyte level. Option is hyperglycemic hypersmolar state. If your patient is in an emergency of HHS, hospitalization and intensive care is must. Intravenous fluid and insulin therapy is also crucial. Frequent monitoring of blood glucose and electrolyte level should also be done. Allergic reaction with hypoglycemia. Administer epinephrine if prescribed and available. Provide glucose to rise blood sugar level. Seek emergency and medical care. So this is the management of diabetes and different cases of diabetes. Last portion of our video is things to avoid during diabetic emergency. Avoid delaying. Do not delay treatment in diabetic emergency. Seek medical help promptly. Second is avoid overuse of insulin. Ensure insulin dosage are administered as prescribed to prevent hypoglycemia. Avoid self-treatment. In severe cases, do not attempt to self-treat diabetic emergency. Professional medical care is essential. So it is crucial for individuals with diabetes and their caregivers to be familiar with the signs and symptoms of diabetic emergencies and to have a plan in place for managing them. In severe cases, always seek immediate medical assistance. So that's all. If you learned something valuable from this video, please like this video and subscribe this channel and stay tuned for the next video. Thank you so much for watching.